Hello, everyone, and welcome to Living Healthy and Aging Well. My name is Ken Hageland, and we are broadcasting from the AM 950 radio station that overlooks beautiful Bryant Lake Regional Park, located in Eden Prairie, Minnesota. I say this every weekend. It's another beautiful day here in the Twin Cities, and my guests can vouch for that. We were outside talking, and it is gorgeous here in the Twin Cities, and I am so grateful to be here with you today. I hope all of you listening are doing well. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to help you and your loved ones improve and enjoy your quality of life. We have another great show for you today. Joining me in a few minutes will be Mary Gaish and Jenny Floria to talk about pediatric palliative care in Minnesota. Mary is Crescent Cove's executive director, and Jenny is the director of engagement. They will talk about the families served by facilities like theirs and what makes pediatric hospice care so unique from adult hospice. Crescent Cove is the only pediatric respite and hospice home in Minnesota and one of only 4 in the U.S. Instead of being a place of sadness, Crescent Cove focuses on making moments count and bringing joy to children with shortened life expectancies. You will enjoy listening to my conversation today with Mary and Jenny. I want to thank all of you that leave us messages on our radio show phone line. We appreciate hearing from you, and we welcome your comments, questions, and topics for future shows. Also, if you are interested in being a guest on our radio show, please call or text us at 612-999-3426. You can also contact us on our website at Living Healthy Radio. There you can find information about upcoming guests as well as listen to our previous shows. We look forward to hearing from you. We are adding new listeners to the show each week, not only here in the Twin Cities of Minnesota, but also throughout the country. You can find podcasts for all of our radio shows on the AM 950 radio website, as well as your favorite podcast platforms, including Apple iTunes, Spotify, and many other podcast and streaming services. You can also watch our broadcast live on the radio station's Facebook page at AM 950 Radio. If you have a question for us today, there are 2 ways to reach us. First, by calling the AM 950 radio station, and our friendly show engineer, Patrick, will get your call on the air. Our phone number is 952-946-6205. Once again, 952-946-6205. Or you can directly text us your questions at 612-999-3426. Now, don't worry. If you missed our contact numbers, I'll repeat them throughout the show. All right. I want to welcome my guests for today's show today, Mary Gaish, Executive Director, and Jenny Floria, Engagement Director. Welcome to the show.
Oh, we're so honored and excited to be here with you this morning, Ken.
Well, I know we've tried to get us connected for a long time now, and Jenny, I've known you for a while, and Mary, I'm getting to know you today, and this is really exciting. Myself and my team have been talking about you guys just because we're in kind of a similar world in hospice care, and so this is great. It's taken about 7 years to do this, but finally
here we are,
which is just fantastic. All right, well, so the audience loves to hear about who I have on the show. They'd love to hear a little bit of background. So who wants to go first and just share a little bit about your background and then how you ended up getting connected into Crescent Cove?
Well, again, I'm Mary Gaish. I'm the Executive Director of Crescent Cove. I've only been a part of this amazing story for about a year.
Oh, perfect, yes. Though. I mean, you bring just fresh perspective.
Yes, I'm so joy-filled to be part of this story. Yeah. I came from a long background in nonprofit human services. I worked at, many of you know, Hammer Residences, where I helped support people with disabilities through all stages of their life, from maybe graduating from high school, living in their first apartment, and then walking with them and their families through sacred end-of-life care. But long before I even started Hammer, as a child, I had suffered some traumatic losses. So I, at the age of 16, asked if I could volunteer at the Red River Valley of the North Hospice.
In Fargo.
In Fargo, North
I
Dakota.
was just there last week
That's
for
so
their
amazing.
open house.
Wow, amazing.
Yes. Well, that's interesting. I didn't know that about you.
Well, of course, they were a little ambivalent about a 16-year-old, right? I think they said, you can go through the training.
Yep.
And then if the families want to have a 16-year-old volunteer, then we'll call you.
Yeah.
And I don't think they ever call. But you know what? It's amazing, that experience of going through that training to learn how to care for families and folks going through end of life just was so moving and essential, and it shows up every day in my work even now. So they do a heck of a good job with that training.
Oh, yeah. Well, it's a great organization, but they just changed their name to Hearts in Action.
Oh, what a great
and
name.
they just opened up the first GIP respite care facility in North Dakota.
Oh,
and
I'd love to hear that.
Oh my gosh, it's great. It's it was a 4-hour drive up there, but it was so worth it. The people there, again, people in our profession are just the most amazing people. So anyway, great. Well, that's a great connection with a great group up there in Fargo.
Yeah, and when I'm not supporting Crescent Cove, I have a side hustle as the mayor of the fine city of Lauderdale. And
right.
I live with my husband and an excessive number of teenagers, dogs and chickens. So that's me.
Well, it sounds like a full life and great work that you're doing. Well, fantastic. Well, Jenny, tell us about you.
Okay, so I'm Jenny Floria, Director of Engagement and Communications at Crescent Cove. I've been there as an employee for 3 years, but before that, I was actually on the very first fundraising committee in 2011. So at the time, our founder, Katie Lindenfelser, she had the idea to build a children's hospice home. She's a trained music therapist, and she learned that there are 54 hospice homes, children's hospice homes in the UK, and at the time there were only 2 in the United States. So she went to get her. I'm sorry, I'm going into her story because it's related to mine.
No, it's it's important. Yeah. The founding visions are so important.
Yeah. So she got her master's degree as a music therapist at a hospice home in Australia. And her then boyfriend, who became her husband, was like, why couldn't you have done that at one in the United States? And she said, well, there's only 2 here. And they committed together to building the third. As a matter of fact, when they got married, their wedding gifts from their wedding, instead of asking for things, they asked for donations to create the first fund, which would eventually end up funding Crescent Cove. Wow. So the reason why this is important is because when she was in the process of talking to all the children's hospitals in the area, I was working at Gillette Children's, and I was doing fundraising at Gillette. And so she was talking to their palliative care people and to their physicians and care teams and saying, if we open this children's hospice home, where would your care end and where would ours potentially begin? And coordinating with them, and then was like, by the way, I also need some help fundraising. Do you have somebody who does that? And they were like, well, we have this person, Jenny. So you could maybe talk to her. And if you meet Katie, you cannot help but get sucked in. She just speaks to you like you're the only person in the room. And she just pulls everybody into her vision. It's really a beautiful thing. So in 2011, I joined the first fundraising committee as a volunteer and stayed in touch all these years. And then 3 years ago, when the opportunity came up to join the staff, I actually closed my consulting practice so that I could join the staff because it's such a powerful mission.
Wow. So you were a part of it for over 10 years before you actually joined the organization.
Yes. And it was really a little surreal coming back to it because there were many of the children's stories that I had written their stories, that I had interviewed the families and written the stories from 2011 on, and those children had since passed. Yeah. And then to reconnect with those families as bereaved parents was really powerful.
Oh, wow. Well, I had a chance to run up there this week and just walk the grounds, and again, it's just gorgeous. I would encourage anybody listening just to go up there. It's just so peaceful. Brooklyn Center, right?
Brooklyn Center, yes.
Yeah. So it's not that far of a drive from really anywhere in the Twin Cities, but it is beautiful. I mean, the work that she did and the rest of the organization did to create this area, and we'll talk more about that here shortly. But I was just going to tell you, it was just so peaceful to walk around the property and to see all the things, and it's right on a lake, Twin Lakes.
Twin Lake.
Twin Lake. Twin Lake. So I'm sure there's a story behind that name. But yeah, it's a gorgeous property, gorgeous facility, gorgeous grounds. I mean, the waterfall that was built there, I mean, just it's gorgeous. just so many things about it. It's nestled in a residential area, so
it's kind of surprising, isn't it?
Right. It's really off the beaten path. You don't
Yeah.
even realize it's there.
When you drive down Bass Lake Road, you go by
Yep.
all these little starter homes, super cute little lined-up homes, and then you take a left in our driveway, and it opens up on this vista that is just surprising.
Yeah.
And there's turtles, and there's great blue herons, and there's
Bald eagles.
pollinator gardens, and the neighbors come and take the children out on the lake in their pontoon boat. It's just so magical.
Yeah.
I just have to say, while we're talking about Jenny, though, we should talk about your T-shirt, Jenny,
Oh, yes.
which has a beautiful rainbow.
So this is I wear this at Crescent Cove. The reason why I wore it today is, and I love this, it's actually from a friend of mine who was going through a really difficult cancer journey for almost 10 years. She is now cancer-free again.
Wow.
She's doing really well. But for years, she had a saying, find the good. And then once cancer came back once more, she was really struggling to find the good. And so
Yeah.
she revised it to honor the hard, but find the good.
Wow. That's great. That's very insightful. All right. Well, the music is cueing us out.
All
So we're going
right.
to take a quick break. We'll be right back to continue our conversation with Mary Gaish, the Executive Director, and Jenny Floria, Director of Engagement at Crescent Cove. And they're talking about the families served by facilities like theirs and what makes pediatric hospice care so unique from adult hospice. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well.
Hi, I'm Corey Wisco, president of the Welshire. The Welshire is a community that provides memory care to its residents, and we have a location in Bloomington and also another one that we just opened in Medina, Minnesota. But the big question is that why do people come to Welshire? Many of the people coming to Welshire are coming from other memory care communities where they maybe haven't received bathing, they've had problems taking medication, or inconsistency with staffing. Welshire has never used a temporary staff. We always have our own people, and it's those people that make the difference. We have always felt it's so important to have 24-hour nursing in the building. The other thing is you have to have an amazing activity team. Nobody employs more activity people than Welshire. Our activities begin in the morning, go all the way through the evening, 7 days a week. So if you have a loved one that needs memory care, come visit WelshireMN.com and book a tour today.
End-of-life decisions are not easy to make. Hi, I'm Mary T. of Mary T. Hospice Care. It's important to make sure that this difficult time is meaningful and comforting to you and your loved ones. Our hospice team provides an individualized program of physical, emotional, spiritual, and practical care so your loved one is comfortable and not in pain. At Mary T. Hospice, we understand that choosing the right hospice care provider can be overwhelming, but we're here to assist you. Learn more today at MaryTInc.com.
Food, music, family. Discover the Slavic experience. Saturday, August 2nd and Sunday, August 3rd at The Rock in St. Louis Park. Polish music from Polka King, Ukrainian band Yev, gypsy music, a donut eating contest, fashion show. Whether you're a Slavic immigrant, have roots in one of the 14 Slavic nations, or simply want to experience Slavic culture, don't miss Slavic Experience, August 2nd and 3rd at The Rock in St. Louis Park. For more information, SlavicExperience.com.
Minnesotans age 65 plus might qualify for Health Partners Minnesota Senior Health Options. The easy all-in-one plan includes personal support, coverage for medical, prescription drugs, and dental, plus many extra benefits. Eligibility information is available at healthpartners.com/oneplan. Health Partners is a health plan that contracts with both Medicare and the Minnesota Medical Assistance Medicaid program to provide benefits of both programs to enrollees. Enrollment in Health Partners depends on contract renewal.
Hi, Penny here from Nightingale in Minneapolis. Exciting news! During the warmer months, we're extending our charm to the patio. Imagine savoring your favorite dishes outside, surrounded by the lively energy of South Minneapolis near 26th and Lindale. And guess what? Nightingale's patio is not just a dining space, it's also dog-friendly. Craft cocktails, curated wines, and half-price bottles of wine on Mondays are still part of the deal. Open daily 5 p.m. to 1 a.m. with a full menu until midnight. Join us at Nightingale where good times and great flavors come together.
All right, welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Hageland, and joining me today is Mary Gaish, Executive Director, and Jenny Floria, Director of Engagement at Crescent Cove. And we're going to learn all about Crescent Cove today, and it's one of only 4 facilities in the U.S. that does the work that they do, and we're going to talk about what that work is here in the next segment. They serve families, and they serve the communities here with just amazing care for very, very special children. And so I'm so excited to have them here. Mary, how can our listeners contact you or your organization if they have questions or want more information as we go through the show here? What's the best way to reach you guys?
Well, we have a beautiful website.
You sure do.
Yeah, which is www.crescentcove.org. And there's a place on there where you can reach out to ask for information. You might know a family who wants a referral to our services, or you might just want to find a way to support us, and it's all there. So feel free to reach out.
Yeah. Just
we love to hear from our community.
Yep. And Crescent spelled CRESCENT, Cove, COVE.org. And we'll mention that throughout the show. And up in the upper right-hand corner is a purple Give banner. And you just click on that, and that is going to be great. And we're going to talk about the funding and how people can support you here throughout the show. But I want to make sure people knew where to go, because a lot of people follow along on the broadcast here. All right. Let's talk about the services that you guys provide, because they're so unique. I don't think many people really even know that they exist. Mm-hmm. So let's start with however you guys want to go about the services here.
So I can talk a little bit about the 2 ways that we support families.
Yeah.
We primarily support the only definition that a family needs to qualify for care at Crescent Cove is that your child has the clinical definition of a shortened life expectancy. So that basically, for many of our kids, means they have multiple diagnoses. Mm-hmm. They may have suffered a brain injury during labor and delivery that resulted in these conditions. And often we have rare diseases as well that we serve these children and families. One of the ways that we serve them is through respite care. Mm-hmm. So for most of these families, one or the other parent has become a full-time caregiver for that child. And it's a 24/7 thing that they're doing for their kids all the time. So they can bring their child to Crescent Cove. We work with all of their care providers to get all of their orders and all their meds and all of their therapies. We take over the full medical care of that child for 2, 3, 4 days at a time, and the parents get to take a break from caring for their child. So not only does that child receive exceptional medical care, but they also get music therapy, pet therapy, in the summer, pontoon rides on the lake, all kinds of arts and crafts, fun time with all the people. It's really special. A lot of our kids call it Camp Cove because they have a great time. And at the same time, then the parents, for a lot of them, it's the first time they've been away from their child since they were born. We had one family who came, and they came all the way from Lake Michigan area of Wisconsin. So it's a 6-7 hour drive for them. Their son was 16 years old. It was the first time they had slept away from him since he was born. And they couldn't believe it. They were just in shock that they didn't know we existed, so the fact that they drove so far, because we were the closest one to them, and they could not believe how much they needed that break. It's one of those things where life just keeps going, and they don't realize how much they're pushing themselves and how much they are exhausting themselves until they get that break. So that's probably the majority of the care that we do. We do end-of-life care as well, because, of course, these families also, they have a shortened life expectancy. We actually, in our 7 years, we only have had 19 children age out of services. The rest have either passed away or we are currently providing services to them.
Wow.
And we've served over 400 families. So just to get a sense of the challenges that these families are facing.
Yeah, and the scope of the opportunity for us to be able to serve.
Right. Yeah.
Wow.
And children also come to us just for end-of-life care, and they might not be a family that we cared for in respite. We've had families come from as far away as North Carolina and Kansas, and we might be caring for a child who maybe had an unexpected life-altering accident, life-ending accident. We might, we have had multiple babies who have come to us who have conditions in which they cannot survive even through infancy, and we're able to provide a loving support for those, precious families. And children who may have, cancer, other unexpected later childhood diseases. So those families aren't always part of our respite care story because they didn't even know that was a service they might necessarily one day need.
Right.
But they do want a beautiful setting where they can care for their child and where the family can be lifted up and supported, and neighbors bring meals, and weird-looking therapy ducks come to visit, and rescue horses come. But I think a place where someone can sit by their side and hold their hand. And we've heard more than one time from parents who maybe they had a child who was born who has never left the hospital. Right. They come to Crescent Cove. They say, we kicked our shoes off. We knew right away this was home. Yeah. And also, this is the first time I felt, we heard this from a family we just cared for, the first time I felt like a mom, a real mom, not like a caregiver, right. Not like somebody doing 24/7 cares. We care for families with children with such high medical acuity that there are some children that need medications done every hour, 24 hours a day. Oh. So literally, there's no point in the story in which mom ever gets to sleep, right. And I remember one child that we cared for who had that level of need, because we have children with trachs, and we have children with vents, and we have children who have G-tubes and J-tubes. Many of our children are not mobile. Many of them can't eat by mouth. But this one mom we'd gotten a beautiful donation of bread from Panera, and we were saying, take some home with you. And her gratitude, you could see even the struggle for her to earn a living where she can have the capacity to care for her family that way it was very moving. Mm-hmm. Wow. So, many challenges in supporting these families and all the needs they have to support their precious children.
Yeah. Mm-hmm. So, like in adult hospice, there must be a diagnosis with a disease progression of 6 months or less for a terminal illness. And so that's what allows for eligibility for a person to receive hospice. So with your world, though, as a pediatric, there's no 6 months. I just want to make sure people are not confused here, because it's again, it's care, it's end-of-life care, or it's respite care, very similar to what hospice does. Yeah. But it is different in terms of qualifications.
The clinical definition is they have to be expected to not live past the age of 21.
21, right. Yeah. Got it. All right. Well, it's time for another quick break here. We'll be right back to continue our conversation with Mary Gage, and Executive Director, and Jenny Floria, Director of Engagement of Crescent Cove. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well.
Hi, this is Laura with Food Freedom Radio, and I invite you to discover 2 local grocery stores with a global fare. Market Fresh, south of Rosedale, carries fresh vegetables, quality meats, seafood, and a wide variety of grocery staples, all in a welcoming store. Shanghai Wholesale Market is in the St. Paul Midway area, and it's a food warehouse open to the public. Shanghai Wholesale carries more than 500 types of noodles, and frankly, it's time for Minnesotans to learn that pasta is a little bit more than spaghetti noodles and tuna casserole. There's sweet potato, bean, rice, fresh, frozen, dry. It's a paradise for those seeking gluten-free pasta. Also, both Market Fresh and Shanghai Wholesale Market seek to buy local, so you can look for local quail eggs, unique cheeses, and Minnesota-made tofu. Open the door to food abundance. Discover Market Fresh, your local Asian food store just south of Rosedale, and Shanghai Wholesale Market, your local international food warehouse north of Menards in the St. Paul Midway area.
Greg Bakken here. Like you, I love good, fresh, delicious food. So I want to tell you about this treasure in Roseville called Mavericks Real Roast Beef. Mavericks has the best roast beef sandwiches I've ever had. Made fresh every order. Add fries or onion rings dropped in the fryer when ordered, and you have a winning combination. Mavericks Real Roast Beef has a lot more than roast beef, So check out their website, mavericksbeef.com, or check out their restaurant on Lexington in Roseville.
Hi, this is Frank Brown of Minuteman Press Uptown with a question for our listeners. How important are business values to you? When you need high-quality digital print, it matters who you work with. You see, Minuteman Uptown is unique. We're one of the only union print shops in Minnesota providing our team with living wages and benefits. We believe in second chances for justice-impacted individuals who want to contribute to the community, and we are active in local issues. We've been in the streets standing up for racial, social, and economic justice. At Minuteman Uptown, our mission is to connect all communities through technology-driven print solutions. An example of that mission is when I moved Minuteman Uptown to North Minneapolis. We're invested in this local community, and we help small businesses and local organizations throughout the Twin Cities reach their audiences. Reach out to Minuteman Uptown and partner with a printer that shares your values. Call us today at 612-870-0777 or visit us at mpuptown.com. That's mpuptown.com.
Turn to Auto Technical with your vehicle donation. We have families waiting for a car. You know, over 85% of unemployed are successful in finding and keeping a job if they have dependable transportation. A car plus a job equals a life changed. 612-919-5526. We have families waiting for a car. 919-5526 or autotech.org.
With a look at your AM 950 weather, I'm Patrick Lilia. Today, sunshine with a high of 90. Tonight, clear with a low of 72. And Sunday, more sunshine with a high of 92. For more than 40 years, the Great Wall Restaurant has been serving up Szechuan and Mandarin favorites. The Great Wall is located just north of 50th in France on the Minneapolis-Edina City line. Check them out at greatwallrestaurant.us.
AM 950 KTNF, St. Louis Park, Minneapolis, St. Paul.
Saturday.
Welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Haglund, and joining me today in the main studio here at AM 950 is Mary Gaish. She is the Executive Director, and Jenny Floria, Director of Engagement at Crescent Cove. And we're learning all about the phenomenal services that this very unique organization has to offer to families and their children. Okay, before we return to our conversation with Mary and Jenny, I want to mention this show is brought to you in part each week by Minnesota Hospice. Minnesota Hospice is an independent, locally owned medical practice serving our Twin Cities communities with comprehensive end-of-life health care. The team at Minnesota Hospice provides patients and family members with award-winning end-of-life health care services. You may not be aware that hospice brings compassionate medical, social, emotional, and spiritual services to your home with typically no cost to you or your family. Please do not wait to learn how hospice care can benefit you and your loved ones. If you have any questions regarding end-of-life care or support, please contact the compassionate team of experts at Minnesota Hospice. They are available to answer your questions 24 hours a day, 7 days a week by a registered nurse. Their phone number is 952-898-1022, or simply visit them online at minnesotahospice.com. All right, let's return to our conversation with Mary and Jenny. If you have a question for us, please give us a call, 952-946-6205, or you can text us at 612-999-3426. All right, so let's tell our audience, again, how they can get a hold of your organization.
At our amazing website, which is www.crescentcove.org, CRESCENT, Cove, COVE.org, and just reach out. We love to hear from folks, and we have so many beautiful friends and community members who support us. We're just welcome to an opportunity to connect with you.
Yes, and we should mention you've got some events coming up here, too.
Yeah.
Before we get too far in the show, I want to mention, get on the website. It is a beautiful website, and it really reflects the beauty of their home that they have in Brooklyn Center. It's just fantastic. But
Our
let's talk about
our next one that's coming up is Corks for a Cause.
Yeah.
The most amazing gift about this event is that we actually don't even put it on. Everly Farms puts it on for us. We are so grateful for their partnership in doing that for us.
Yeah.
This is the third Corks for a Cause event and the second one benefiting Crescent Cove. So it is on August 16th at Everly Farms in the evening. It is wine tasting, food stations, live music, entertainment, silent auction, live auction, and a really, really special program as well. It's absolutely a beautiful summer soiree, as I put it, because it's a lot of fun and beautiful. I appreciate that they're willing to hear the stories of many of our families. As a matter of fact, there is a family who is sponsoring it this year who in 2023 we served them for end-of-life care for their infant son. And they're a beautiful family, and we so appreciate that they continue to support us in memory of little Theo.
Oh, yeah. Wow, 10-plus Minnesota wineries are there.
Yeah, they're up to 13 now. They
13.
keep adding more and more and more. I know.
10-plus, so I guess that covers.
Yeah.
And in Minnetrista, Minnesota.
Yes.
So,
Such a beautiful setting.
Yeah.
We're just really excited to be there again. It's a really fun evening.
Wow, August 16th, 5 to 9. Wow, fantastic. If you have any questions, folks, about that, just go on crescentcove.com, and you can pull that up there. It's in the top banner. And what a great event. What a great cause. All right. Well, let's keep talking about the services and what people can expect when they look into the services you guys have.
Here's the thing that I think is most surprising for people is they expect that our home is a place of sadness and of solemnity. And it is absolutely the opposite because we serve children.
Right.
And our goal, our tagline is making moments count. And we truly live by that in every aspect of the way. Whether it's respite care that we're providing to kids, we know that these children have shortened life expectancies, so we work on making every moment count. So when they are with us, it isn't just about the exceptional care they receive, it's also about the experiences they get to have and the things that they get to do that I think a lot of people assume that they have access to. But because they live with disabilities, they often don't. Yeah. So things like a pontoon ride, so many times our parents will tell us, I didn't think to take them on a pontoon ride. It was daunting to me because I thought, what if something happens? Right. I need emergency meds. I need emergency things. And we know that. And when they go with a registered nurse who has all of the supplies with them. They pack it all up and are ready to go so that if there's something that happens. So for many of our kids, it's their first time on a pontoon.
Oh, I'm sure. Yeah. And again, you're on Twin Lake. It's gorgeous. It's gorgeous. Beautiful. What a treat for a child.
Yeah.
There's just such a sense of joy that most children are just have. And it's got to be contagious for your organization.
Yes, the sense of play is so much fun. We had one child there recently who had a remote control car, and he was using the remote control to chase the nurses with the car. And we were all laughing so hard we couldn't quite get through our business meeting. It was a lot of fun. But I wanted to share a little bit about the scope of the need, Ken, because it's so amazing to me. We did a demand analysis for our care just this last year, and we learned that if we met half of the need in the Twin Cities metro area alone, we would need 72 beds a day, and we have 5. Oh. So we are both imagining our way towards a future in which we open a second facility and we can provide more support. And then we have to constantly think about ways that we can provide some of this care outside of the walls or outside of that specific moment that families are so hungry for. Yeah. So we provide a sibling camp where we close the house for a couple of days.
Oh,
the siblings are all jealous that their siblings get to come there. So sibling camp, they come, they have fun. We had ninja obstacle course, the Raptor Center, Disney princesses. We had 29 kids this summer.
Wow.
And it's very moving for them to just be with other children who have the same lived experience. They can see, I knew I was going to be late because my sibling had 4 medical appointments, but I knew no one was going to be mad at me. Oh. Or I was looking forward to coming this year because I knew this child, my friend, lost their sibling last year, and I know when I go through it, someone will understand what I'm going through. So that is really special. We are planning a mom's retreat for the moms to get away and do yoga and all kinds of neat things that we have planned for this fall. We are also planning fun activities for dads. It's kind of funny. A lot of us, the social work team is, we're gals. Yeah. So while we were so busy planning the mom's retreat, we're thinking, but we got to do something for the dads, but what? Maybe not the yoga, maybe not the meditation. So anyway, we have dads grill outs where they just get to hang out together, fish off our dock. We're learning about ways to care for families and bring them together in community with each other. And we have special events like Remembrance Day where families come and we have a little ceremony, usually a beautiful day in the fall. And one thing that's really meaningful is we write for the bereaved families, we write the names of their child in chalk, beautiful chalk, and a little station for them. And because what we often hear from people is we want to hear people say our beloved child's name. Yeah. We want people to remember our child. This child isn't going to have a future where, like this morning, my teen sons, they just graduated from high school and their kindergarten teacher sent a package to them. And they're not going to have a future in which they have that opportunity. And we want to be in a space where people remember and can say their names. So lots of different ways to care for families. Can we offer more? Could we offer some day respite? So families, we had heard from one mom, I haven't been to the dentist in 7 years because there's no babysitter who can take care of my child.
Yes, a complex,
Can we, so are there ways we can think of expanding this care for families? And we're constantly inventing and doing some new things. So, yeah.
And at the same time, the demand for our current overnight respite care is so high. Any given month, we get we schedule in advance and we get all these requests in for the month. And any given month, we have between 11 and 30 families who have requested respite for that month, and we can't accommodate them. So it's a continual challenge. And we have had in the past, when we have end-of-life care calls, depending on our staffing, and as we all know, there's a nursing shortage, a global nursing shortage. Depending on staffing, we've had to cancel respite cares that families have looked forward to for months.
Planned.
So that we can accommodate an end-of-life care. Yes. And they understand. Of course, end of life is a priority. But our care coordinator, literally, her heart breaks when she has to make that phone call to a family. And we had an end-of-life care over the 4th of July this year. And it was the first time that we were staffed well enough to the point that we did not have to cancel any respite stays, and were able to also accommodate this family. It was really magical too, because we put the call out to all of our volunteers who have said, I want to support families during end of life stays, and they want to make meals and so forth. And we thought, it's a holiday weekend, we're not going to get it
right
within 12 hours. The schedule is full. We had everybody came out of the woodworks to help support this family. It was really special.
And even our medical director came to the house on that Saturday to help, because sometimes you mentioned 1 RN going out on the pontoon. Sometimes it takes 2. And in this case, it took a medical director because this child had such an unusual, condition. And so the idea that someone would come on a holiday weekend to provide that little extra love and care so that family could have a joyous memory to celebrate that is part of the magic of the work that we do.
Yeah.
We had our IT consultant come in and clean. He said, I'll come in. I'll clean on the 4th of July.
Bless. Just amazing. The volunteers that we have are absolutely exceptional. Yeah. And it's one of those things, I've given so many tours of our home, and after the first 5 minutes of touring people around, they said, I could tell the moment I walked in the door that there was something about this place that was really special and felt very warm and compassionate from the moment you walked in. I don't know how you create that, but somehow, Katie created it and we continue it.
Wow. And just one quick word about that. The architects who helped us design this beautiful space they did a lot of work with families to say this is what every family should feel, and every child and every volunteer and staff person when they walk in the door, and they want them to feel embraced, celebrated, and assured. And I think you really do, even on the grounds, Ken.
Yeah.
With all the beautiful native plants, the turtles.
Well, just the donor walk of bricks there was amazing to listen to this or look at the stories and some of the things that are inscribed on those bricks.
And the volunteers built that little waterfall.
Did they really?
They did.
But then we built it so it'd be handicapped accessible, so children in wheelchairs could connect with it.
Wow.
Yeah, it's really, and that walkway too, the memorial walkway, remains in there, some of the bricks from when it was an adult hospice home before we took it over in 2017. So those families' memories remain there as well.
Wow. People, you've got to go out and see this place. No, really, you got to go see this place.
But
All
call
right.
first.
But call first. That's true. I've learned that lesson. It's time for a short break. We'll be right back to continue our conversation with Mary Gaish, Executive Director, and Jenny Floria, Director of Engagement at Crescent Cove. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well.
Peace of mind shouldn't cost a fortune. We keep things simple at Schroman Law because we believe planning for your estate and end-of-life care shouldn't be stressful or expensive. Every client relationship starts with a free consultation so clients have the information they need before making important decisions. From there, we work closely with clients to ensure they are choosing the most efficient and cost-effective plans for their specific needs. Schedule a free consultation today at schromenlaw.com. That's SCHROMEN law.com.
End-of-life decisions are not easy to make. Hi, I'm Mary T. of Mary T. Hospice Care. It's important to make sure that this difficult time is meaningful and comforting to you and your loved ones. Our hospice team provides an individualized program of physical, emotional, spiritual, and practical care so your loved one is comfortable and not in pain. At Mary T. Hospice, we understand that choosing the right hospice care provider can be overwhelming, but we're here to assist you. Learn more today at marytinc.com.
Hey everyone, this is longtime AM 950 host Ellie Krug. I'm thrilled to announce my brand new show, The Illegal Trans Woman, which takes advocacy from my community, transgender and gender variant people, up several big notches. The Illegal Trans Woman will feature interviews, commentary, and information aimed at pushing back against efforts to oppress trans and gender variant humans. Please tune in on Saturdays at 4 or wherever you go to get your podcasts. And do me a favor, share about the show. Thanks.
Overwhelmed trying to make sense of Medicare? As a licensed advisor, I can help you determine your healthcare needs and evaluate your options. I'm Harvey Pearl of Pearl & Company, and I want you to have the peace of mind knowing you have the best coverage available. You deserve an advocate you can trust and coverage you can rely on. And there's no fee, ever. Annual enrollment is October 15th through December 7th. Call me now at 651-303-8889 so we can strategize together.
July is the annual store-wide sale at Woodland Stoves and Fireplaces. Come see our diverse selection of wood, gas, or electric fireplace products for indoor and outdoor living. And right now, Woodland Stoves and Fireplaces can assure you the best price of the season on every product in the store. Let Woodland Stoves and Fireplaces help you choose and experience the joy of sitting by a fire.
Summer is a great time to install your fireplace. You can find your perfect fireplace and have it installed and ready before the cold weather hits again. If you already have a wood fireplace, consider a fireplace insert. Come and see the entire selection at Woodland Stoves and Fireplaces on East Franklin and Riverside in Minneapolis. They will create a fireplace that works for you. Efficient, clean burning, and environmentally smart.
Woodland Stoves and Fireplaces, since 1977, out of the ordinary products and services to make fire work for you.
Welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Hageland, and joining me today is Mary Gaish, Executive Director, and Jenny Floria, Director of Engagement at Crescent Cove, and we're talking about the families they serve by facilities like theirs and what makes pediatric hospice care so unique from adult hospice care. If you have a question for us, this is the last segment, folks. Please give us a call, 952-946-6205, Or you can text us at 612-999-3426. And the texts that I'm getting here are talking about, well, what does it cost? So we'll have to address that here in this last segment. Okay, Mary, so when people are looking for more information and when I reach out to you guys, what's the best way to do that?
Just jump on our website, which is www.crescentcove.org. And we have an info@crescentcove.org email, and just send us email, and we'll figure out how to get an answer to your question or how to help you connect.
All right. And you're a 501(c), so you guys live off of donations, and it's such a critical part of the services. And there's a nice purple banner that people can click on if they want to do a donation. And you're always looking for volunteers too, I imagine, right?
Yes.
So resources and time is all accepted.
Absolutely, yes. We have over 120 volunteers annually who help us run our home, from spending time with the kids and helping them have special experiences, or even cleaning our house.
Yeah.
And I cannot tell you how much I am so grateful for them. Every single time I see them, I said, thank you, because I don't like cleaning my own house, much less going to somebody else's.
Well, and you're busy with all the work you're doing there at the organization. All right. Well, sounds good. Well, last segment. So let's focus on just the most important things we want to get in front of people before the end of the show.
Oh, well, let's just talk a little bit about that cost, Ken, because we do provide this care for families and children at no out-of-pocket cost. And many of our families, I think 80%, are eligible for Medicaid to support their children. And so we are able to bill some Medicaid waivers for that cost. But if families don't have that resource, or if they need to allocate those Medicaid funds in a different way, we just go ahead and fundraise to cover the cost of that care. And I think last year, Jenny, you shared we just had our
audit approved, and 76% of our revenues in 2024 was philanthropy.
Wow.
Donations are what absolutely, if it weren't for the generous support of our community, we wouldn't exist to support these families.
Wow. And yet the demand is so overwhelming, as you say, even just trying to cover half the needs of the Twin Cities area. Would be more than 72 beds. Yeah, and you have 5. Wow.
5 beds, yes.
Wow.
And so many families in need of that care and support. And we are just so blessed with a community. We have family foundations that support us. We have so many beautiful individual donors. We have folks like Everly Farms putting on these third-party fundraising events for us, which is so magical. All the volunteers that come in to care for our home. And I did just want to quickly share. I want to talk a little bit about Medicaid. But just quickly share a beautiful story that happened over the 4th of July weekend to show all the ways you can care for an organization like this, and sometimes you don't even know that you are doing that. So our director of nursing was there very late, admitting this child, this precious infant, for the end-of-life care. And we all jumped in to say we're going to volunteer to bring in a meal, but there was one gap in the schedule. And so she was going to make pasta salad, but she realized after she made it she didn't have quite enough. So here it is. It's the 4th of July. It's midnight, working long hours. And she heads to the one grocery store she can find open to buy these few ingredients she needs. And as she's standing in line, the gentleman in front of her turns and looks at her and says, I'm going to pay for this lady's food, which was just so magical. And so she was very humbled. He paid for the food. He was with his 20-year-old son. She went out in the parking lot. It's very late. She's very tired. She thought, I need to tell this man who he's really buying the food for.
Yeah.
And so she went up to him and said, excuse me, sir, can I just, tell you who this is for? This is for these young parents who we are caring for as their infant is, at the end of life. And your food makes it possible for us to feed them in a loving way with support from our community. And he was so deeply moved. It turned out he was a pastor. He wanted to know a little bit more about Crescent Cove so he can pray for all of us. And our director of nursing said, to his son, I hope you are so proud of your dad. I hope you understand that his little act of kindness here has a really big impact for all of us who love and support, these precious children and their families. And just so moving to think of this human being, caring for us in that way and hardly even knowing he was doing it,
Right. Doesn't it give you hope?
It does.
In humanity.
100%.
We have 24-hour news cycles about how bad everything is.
Yeah.
and yet you run across people in your communities that are just angels.
It reminds me, too, that you just don't know what other people are going through.
Yes.
He did not speak to Catherine before he decided to buy her food. And I just think it's one of those things where any small gesture of kindness that you can extend to others might absolutely make their day.
Yeah, right.
And why not just do it?
Right.
And we see it all the time, every day at Crescent Cove. That's part of the joy,
Sure.
So it's, and, when we talk a little bit about families and our friends and community about ways they can support us, some people reach out to us and support us financially, and that's so moving. Some people want to connect us to somebody else who maybe knows how to host an event like Corks for a Cause.
Right.
And, we also have really become aware of the fact that we need to advocate for our families around Medicaid, because that is a huge source of support for them. Without those Medicaid dollars, many of these children would end up living in hospitals. They are eligible for 24-hour a day, RN care, many of them. And then without those RN nurses and respite care, they really wouldn't have a way to be able to manage the demands of this level of care. And so we have had folks who stepped up to say, I'm going to reach out to my legislator, I'm going to reach out to my county commissioner, just to let them know that this kind of respite care and end-of-life care for children is an essential service, and that these families really need and deserve this kind of support. So many folks who reached out, of course, to the members of Congress. Yeah. And it's a story that we're talking about now, and we'll talk about more in the years to come, because we really need support and love and care for these families.
Yeah.
I feel like so many times these families, especially because their children have complex conditions, they feel hidden away in society. Oh. People don't see them out and about because it's hard for their families to get out with them. Yeah. And so that's one of my personal things, and this is me talking personally, I just feel like they need to be thinking about these families who have these needs when these decisions are made about Medicaid or other funding or other needs.
This has been a great show. Thank you guys so much for being here.
Thank you.
You've got to come back, because there's so many things and so many stories we want to share.
So many beautiful stories.
Oh, my gosh. This has been wonderful. So thank you guys so much for being here. I want to thank Mary Gaish, Executive Director, and Jenny Floria, Director of Engagement at Crescent Cove, for talking about how they serve families by facilities like theirs and what makes pediatric hospice so unique and so special. How can our listeners contact you guys if they have questions or want more information?
One more time, Jenny.
Go to crescentcove.org, and you can fill out a contact me form or get more information there.
Fantastic. We hope you enjoyed today's show, folks. Please join us again next Saturday at noon for another broadcast. And thank you for listening to Living Healthy and Aging Well, where we talk about your health and your life. Until next time, choose to live well.